Cancer is the second leading cause of death with over 10 million deaths a year.
The fear is there, but then to really strive and accept the challenge is you want to get well, you want to get better.
According to the Department of Health, cancer is the third leading cause of death here in the Philippines, and it continues to be a growing problem. The WHO reported that at least 1/3 of cancer cases are actually preventable, and preventing cancer begins with proper awareness. So today, let's shed light on this disease. I'm Dr. Freddy Gomez, and welcome to MedTalk Health Talk. Cancer in all its forms and types remains to be a growing concern, not just in the Philippines, but in the entire world. Now, to tell us more about this, we are joined today by the chairman of the Philippine College of Surgeons Cancer Commission, colorectal surgeon Dr. Manuel Francisco Rojas. And we're also joined by Dr. Rachel Marie Rosario, who is the executive director of the Philippine Cancer Society and who is also a cancer survivor. Dr. Rachel, Dr. Rami, thank you so much for joining us on this episode. Let's start off first with a basic landscape of cancer, especially here in the Philippines. Dr. Rami, maraming mga types of cancers. Among Filipinos, what are the more common cancers seen here?
In the Philippines, there are approximately 400 new cases a day and 250 deaths a day from cancer. So that's the reality that we're dealing with here. The number one cancer in the Philippines is breast cancer. 1 in 9 of our women will get breast cancer. It's one of the highest in Asia, followed by lung, mostly caused by smoking, which also responsible for 1/3 of all cancers. And then we have colorectal cancer, which is highly preventable and curable. And then we have liver cancer and cervical cancer.
Dr. Rachel, Dr. Rami mentioned lungs, risk factors, smoking. Bakit breast ang number one sa Filipinos?
It's not just a worldwide trend, but changing lifestyles, less kids or less children. All of these have an effect on hormones, and in this way, the landscape is changing. So yung environment plus yung genetics plus exposure to carcinogens, yung ating pagkain, siguro hindi na tayo masyadong gumagalaw, or maybe there's a slight prevalence of women smoking compared to before. Lahat na ito, these are all factors that can contribute to a trend in increasing breast cancer incidence.
Okay, I agree with that. But Dr. Rami, a lot of people may be watching this and they would be keen on knowing what would be the symptoms for this. Is that the mindset that people should have when it comes to cancer? Being mindful of the symptoms. I'm going to wait for symptoms. I'm going to be mindful, tsaka lang ako gagalaw.
Cancers can be, number one, preventable by lifestyle changes. But screening is another important component. And screening is done on people without symptoms. Okay, so if somebody comes to me with symptoms, that's not screening. No, somebody has come to me because I'm not feeling anything. So at a certain age, people should be screened even if they're not feeling anything. And that's the best chance of catching something early. So for example, for breast cancer, it's mammography if that is available. For colorectal cancer, it's either a exam of your stools called a fecal immunochemical test, followed by a colonoscopy on people who are not feeling anything at age 50 or 45. We recommend that. So these are ways of trying to pick it up early, even before the cancers appear. You can have a polyp, you can have a small nodule that can be removed already. So screening is done on people without symptoms. You're healthy and then you get screened.
Dr. Rachel, do you think there's a type of person who is more prone to developing certain cancers? Are there sort of risk factors, red flags, so to speak, that our viewers should be mindful of?
Well, we do know that there are some women, as far as breast cancer is concerned, who have mutation in their genes. And lucky if you know, so that you want to prevent it, you're more focused. Or unlucky daw if you know, because you can become very paranoid about it. With saying that na, I guess, kailangan naman talaga for all of our siguro kababayans, huwag na lang nating isipin yung high risk ba ko or hindi ba ako high risk, but focus more on how we maintain wellness and good health.
Very good point. Alaska follow-up question on that, Doc Rachel. What do you think about ang kaugalian ng Pilipino na matatakot magpa-check up, magpa-screen? Baka may makita ayoko malaman.
Natural. I think everybody is scared, from lay people to even doctors. Whenever we feel something, we get scared. But I guess we have to be proactive.
Dapat magbago ba yung mindset ng tao?
We need to change it. The screening thing should be there. And then the other one is vaccinations that can prevent specific types of cancer, like the hepatitis B vaccine to prevent liver cancer, and then our HPV vaccines, parang mapababa yung ating rates of cervical cancer. We can do that. Even yung visual acetic acid wash or pap smear, all of these things that can catch cancer when it's at the pre-cancerous stage, kayang-kaya natin gawin yon.
So mas maganda talaga na alam natin, more knowledge is better rather than be afraid of it. The WHO, Dr. Rami, also mentioned about how 1/3 of the cancers is actually preventable. Explain that to us. Explain that to the viewers. What does that mean?
The actual data is 1/3 of the cancers are caused by tobacco. So imagine if tobacco incidence goes down, we will cut down the cancer rates, particularly lung cancer. But tobacco doesn't just cause lung cancer. It causes other cancers, including breast, esophageal. Imagine the impact of just decreasing the incidence of tobacco use. Now, there are others that are preventable. As Rachel mentioned, the vaccination to decrease the incidence of hepatitis B, to decrease the incidence of cervical cancer, that's also possible.
We're talking about tobacco. How does alcohol fare in this equation?
Alcohol too has been associated with increased incidence of cancer of the GI tract, of the pancreas, and of course liver. The cirrhosis eventually will increase the risk for cancer, and that is an effect of alcohol.
So what you're saying, Dr. Rami, is just quitting tobacco, cigarette smoking, and alcohol will improve the chances of me not getting cancer.
Yes, yes.
Now, apart from avoiding external factors that may lead to cancer, early detection can make a huge difference. Now, more on this when we return. So stay here with us on Med Talk, Health Talk. Millions of Filipinos are battling cancer today, and for many of them, cancer care is delayed or inaccessible. But early diagnosis can improve their outcome significantly. Let's welcome back Dr. Manuel Francisco Rojas, who is the chairman of the Philippine College of Surgeons Cancer Commission and who is also a colorectal surgeon. We're also joined by Dr. Rachel Marie Rosario, who is the Executive Director of the Philippine Cancer Society and who is also a cancer survivor. Now, Dr. Rachel, let's talk about your journey. You're also a cancer survivor. Let's talk a little bit about that. You're actually diagnosed with 3 types of cancers in different stages of your life.
Yes.
What was it like when you were diagnosed the first time? What did it feel like? What was your outlook like? And what was it like when you're diagnosed for the second, for the third time?
For the first time, I was only 15 years old. So I guess, when you're a teenager, you feel very invincible. What I didn't like was the treatments. It was long. A lot of the treatments were still in the experimental stages. And of course, you don't like your hair to fall out. If you're a teenager, you don't like to feel you're so down and so tired because you want to go out with your friends. You want to go to school, but sometimes there are barriers because you're immunocompromised. So all of these things you have to take in as a teenager. But it was a little different when you're already an adult. You know more about the world, but on the other hand, you have a lot of things to be scared about. You're probably already married, you have children, and of course, people thinking, I want to see them graduate from college, I want to see them have their own kids. So, different na yung perspective, from a teenager to an adult. Ang fear still is there. Whether ma-doktor ka,
Yes.
mananay ka, ma-researcher ka, or whatever, you will still fear, But you need to go beyond that. You need to probably gather your strength, whether It's from your faith, from your family, from your friends, and from within. Kasi you need to fight back. Or sometimes I would say, do I need to fight back? Or do I need to go with the flow and just redirect where my journey is going to go?
Many viewers might think dahil doktor si Doc Rachel, mas nakayanan niya ang mga diagnosis na cancer. Is there any truth to this? Was you being a physician, did that markedly decrease the fear, the amount of anxiety that you had when you were diagnosed?
Not decrease, no? I think actually nag-increase siya ng konti. Kasi you know this, you've read about it, you're supposed to be on top of it. And you know the statistics, you've probably memorized all the hospitals where you can go. You get a little confused. Sino bang titingin sa akin? Sino bang magtitreat sa akin? Diba? Isipin mo yun, do I stay here? Some will say go abroad. So all of these things you have to take into consideration. Sometimes I think, well, it's only my perspective, better pa kaya if I'm a lay person and then I will just, listen to my doctor, give me the best advice, rather than me sitting there and saying, oh my gosh, where am I gonna go? What should I do?
And we're all glad that you are here with us now, better, despite the journey that you just mentioned. Dr. Rami, with what Dr. Rachel told us about, let's talk about accessibility to treatment. How is it for Filipinos nowadays? If a Filipino is diagnosed with cancer, comparable ba yung treatment niya, accessibility niya with other countries in the world?
Well, we have a very positive development. In 2019, February 14, President then signed into law, which passed Congress already and the Senate. NICA is one of the few unique laws around the world that focuses on cancer, and we have been cited for that. It looks at cancer care in the country comprehensively. It's looking at developing cancer centers across the different regions of the country. It talks about quality of care, talks about screening and prevention, but it also talks about palliative care, and finally, access to care in the sense of financial support for patients. And I have to say, the main drivers who lobbied for the law were cancer patients, support groups. They all came together and pushed. It wasn't doctors pushing, it was actual cancer patients and their advocates. And that's something that has to be understood. We need to listen to our patients. No? We need to understand what their perspectives are, because sometimes doctors can just focus on treatment. So that's something positive for the country, and the implementation is the next step. Now that the law is in place, how do we implement it well across the country?
Now, Dr. Rachel, when it comes to cancer treatment, now we're pushing strides of it being more accessible for people. A lot may be thinking, pagdating sa cancer, cure ba palagi ang goal natin?
If I'm going to talk from the patient's perspective, cure parati yung unang isipin. We really want to get cured. But then, if you're going to go through the process, then you do realize that you want quality of life above anything else. Whether you're under treatment, whether you're in remission, whether you're already in hospice care, you want to be comfortable, you want your loved ones around you, you want a good understanding of what is happening to you, and you want to come to terms with whatever it is that is in front of you.
Does this new NICA law, does this encompass everything there is to avail for Filipinos with cancer?
Yes, including quality of life. If you're a cancer patient, you are entitled to be a PWD, even if you're cured. Because even after cure, many patients live with the side effects of treatment. Yeah, so that's part of the law too. So it's very comprehensive.
I'd like to touch on the pandemic, COVID-19. It has affected cancer patients in terms of accessibility. How is it now? Give us a brief overview on where we are now.
The pandemic was very bad for cancer patients. We had to have a lot of meetings with the commission. Patients stayed away from hospitals. Those that wanted to go to hospitals didn't have the access because there were security checkpoints and all that. And then hospitals were treating COVID mostly, and the census of cancer dropped. Around the world, there's a lot of backlog on cancer treatments, and we actually saw more late stages of cancer, and we're still seeing that now.
Okay, so hopefully things would change more for the better, but we are seeing an uptick or light at the end of the tunnel when it comes to these. We also like to talk about support groups, because there are support groups and organizations today that can help people battling cancer. So more on this when we return, so keep it here on Med Talk, Health Talk. People living with cancer face a number of challenges. Now, there are many things that you can do to help them keep physically and mentally healthy. Let's welcome back Dr. Manuel Francisco Rojas, our colorectal surgeon, and Dr. Rachel Marie Rosario, who is the Executive Director of the Philippine Cancer Society and also a cancer survivor. Now, let's talk about support groups, Dr. Rachel. How were you able to go through your journey? Did you go through it yourself? Meron bang mga support groups?
I did experience being with a support group, especially during the first one. I guess the experience is that when you are with others who are in the same journey, sharing with you what happened to them, how they dealt with it, it helps a lot because you have this like preview of what may come and how you can react to it.
Dr. Rami, speaking about the importance of people talking about cancer, not just cancer in the disease perspective, but the person living with it, trying to get treatment with it, how are we able to collect all that information, collect all the minds to be able to go through a way where the patient is most comfortable in their own journey?
We tend to work in silos, in isolation, and we're trying to break that. So we're very grateful that you've invited us here because you've started the conversation again. And the conversation should be a whole of society approach, listening also in particular to the patients themselves, but bringing together the doctors, the nurses, the data encoders, the navigators, the palliative care physicians, but not just that, government leaders, as well as finance. These are all interrelated, and so the conversation should be a whole of society approach. And that's what we're trying to do. We were holding this National Cancer Summit to try to bring that conversation together with all the stakeholders.
Do you see a paradigm shift in cancer treatment in probably the near future, probably the next 10, 15 years?
I think the NICA law was a big step and really elevating the quality of cancer care, the quality of life of patients, involving patients. Yes, there should be, but there will be a paradigm shift of sorts if we implement the NICA law very well.
So that's something to look forward to. The Philippines isn't lagging behind, especially in trying to move forward when it comes to cancer treatment and care. Is there anything that you would like to address to the viewers? Any tips, Dr. Rachel, especially with regards to someone who may be battling cancer right now?
Don't give up hope because there are so many people who are actually willing to help you. And for those who are healthy out there, always remember the 4 pillars of trying to avoid anything that is related to a non-communicable disease. We will just repeat this. Good nutrition, physical activity, do not smoke, and drinking alcoholic beverages only in moderation. And of course, parang let's try to be happy, keep the stress away from our lives, find ways to cope and enjoy life.
Okay, you're such a beacon, a good source of inspiration, Dr. Rachel. Thank you so much for joining us on the program. Dr. Rami, any advice, any tips for our viewers?
Well, I just want to invite everyone to the Philippine National Cancer Summit. For details, you can go to our website. Here, we try to bring everyone together, so everyone is invited. Patients in particular, we have for patients, patient groups. We have doctor scientific sessions, nursing, oncology nursing scientific sessions. We have one for data encoders who are important in the cancer battle, and for navigators, both leaders in government, national and local, as well as finance. We talk about cancer finance. So we're trying to look at the cancer battle from all angles, and that's what the summit is trying to do.
That is definitely something that is a step forward, not just for those battling cancers, but the Philippines in general. So thank you so much, Dr. Rami. Thank you so much, Dr. Rachel, for being with us. Now, fighting cancer is difficult, and it's crucial that we provide patients with the support, love, and care they need. I'm Dr. Freddy Gomez, and thank you for joining us here on MedTalk Health Talk.